Welcome to the webinar tonight, and I'm going to forward to the next slide. So this is a live presentation here in Dane County. I've got 5 lovely faces here looking at me, and then we're broadcasting out to, should be around 25 counties tonight. A couple had to drop out due to weather, so I appreciate those of you that are with us. So my name is Heidi Johnson. I'm the Crops and Soils Agent for Dane County Extension, and I have with me a couple of extra specialists tonight that will be able to jump in if there's any different information that I'm missing or if they need to give me extra pointers. So I've got Jean here from Covering Kids and Families, and she spends all of her time thinking about the Affordable Care Act, so she's going to be helpful. And I have Tracy here from Apel and Associates. She works with taxes, and so because a lot of this is intertwined with taxes, she's going to jump in here at some points, and she's provided me with some information. So the presentation that I'm going to give tonight is adapted from a couple of different sources. There was some curriculum developed by Rutgers and Kansas State that I've used, and then Covering Kids and Families, which Jean is from, they did a lot of this stuff too, so I just want to give them credit right away. Forward. So first of all, there's several ways that the Affordable Care Act impacts farm families, and that's why I wanted to work on doing a presentation specifically for farm families, because I think they're affected in many different ways by this rather than just a single way like lots of people are. So they are, first of all, consumers purchasing insurance for their own families. So they've got to provide insurance for their own families in some way or provide health care for their families in some way, so they've got to make those kinds of decisions. They're also business owners, so they've got to make decisions for what they're going to do for their the employees for their business and how they're going to handle health insurance in that respect. And then they're also employers managing employees who are also people making decisions on their health insurance. So we're going to talk about that a little bit on the end too. Oh, sorry, I keep pressing the wrong thing. So first of all, we're going to first talk about farm families as insurance consumers. And I just have a couple of little factoids here that I thought were interesting. First of all, farmers are actually more likely on average to have insurance than your average person, which I find pretty incredible since they're often having to get insurance on their own as small business owners. But that may be due to the hazardous work environment of farm work. There's lots of potential for injuries, and they want to protect their farm, so they don't want to have injuries that would put them into a place where they wouldn't be able to protect the land and the buildings that they own. So they may have insurance for those reasons. But overall, farmers rely on individual health insurance policies more than the average American. So 5% of Americans have individual policies, where 36% of farmers do. And that's, of course, because there's few group options for farmers. There's not very many ways for them to buy into a group policy. So they've often either had to buy their own health insurance policy, or they bought a high deductible policy and paired it with a health savings account, something like that, to try to provide insurance. And then, of course, I'm sure we've all heard how lots of farmers have a spouse with an off-farm job, a lot of times for the health insurance, because that's a great way to get health insurance, and the extra income is always good too. So with the Affordable Care Act, there's some changes that happened for consumers, and I'm just going to go through some bulleted points of those. First of all, there's no more exclusions for consumers who have pre-existing conditions. This is already in place for children under 19, but in January 1st of 2014, that will go into effect for adults as well. So this could be a big deal for farmers who may have not had a lot of health care over the last however many years. Farming tends to be hard on the body, so there may be some pre-existing conditions making it more challenging to get health insurance. So that might be an important thing for them. There's no more cancellation of policies for someone being too sick, and this is already in effect. There's no more lifetime maximums on the amounts that can be paid out for essential benefits. And we're going to go through what the essential benefits are in a few slides, but remember when we get there, there's no more lifetime maximums for those. There's no more annual maximums on the amount paid for care for the essential benefits, and that will be starting in January 1st. Young adults that are on their parents' private insurance plans can stay on those plans until they're 26, and we're going to talk a little bit about that, more about that as we go along. There's many preventative services now that are going to be required to be a part of policies without a copay, and I'm going to go through a list of some of the important preventive services that are going to be available. And then something else, and Tracy wasn't sure that this would be as big of a deal, I'm not sure, but profession isn't taken into account anymore when a health insurance quote is given. And of course, we all know farming is a dangerous occupation, and would imagine health insurance premiums are higher for people with more dangerous occupations. So that's, but professions won't be considered anymore when quotes are given for insurance. So here's the essential health benefits that I was talking about. I won't go through all of them. I think you can see them here up on the board. But just things like prescription drugs and maternity and newborn care. These are services that are going to be a part of every healthcare plan that's going to be available. Here's the preventive services that I talked about that needs to be a part of plans without a copay, things like cancer screenings, vaccinations, blood screening, birth control. There's still some debate about the birth control option. If you see that in some of the media, there's been a Supreme Court case going on right now about that one. So some of these things may be in flux over time, but with the way that it was written, these are the preventive services that will be included. There's a more comprehensive list. If you go follow the link below, that's at healthcare.gov, and you can see the whole list there. Basically, the ACA has, they've termed it play or pay rules to the Affordable Care Act. And I'm going to talk about what those are. But basically, you either play from an individual standpoint, the individual mandate says that you either play by getting insurance and having insurance, or you pay by paying a penalty. And we're going to talk a little bit more about what those penalties will be. For employers, they either play, if they have more than 50 full-time equivalent employees, they either play by providing insurance for those employees, or they will pay a government penalty again. And I'm going to go through what the individual mandate is and the employer mandate is as we go along. We'll first talk about the paying part, and then I'll talk about the playing part. So first of all, if you don't get insurance, you will be required to pay a tax. And in 2014, they're going to start off with a lower penalty, and then it's going to get incrementally more as the years go on. So in 2014, it's going to be $95 per adult, or 1% of your income, whichever is more. So I've heard a lot of people say, well, $95, so it's not a big deal. You're going to have to figure out 1% of your income is. It's going to be a minimum of $95. That's going to go up in 2015, and then it's going to go up again in 2016, and that's the final amount, the height of it is 2016, right, Jean? Okay. So in 2016, that will be $695 per adult, or 2.5% of your income, again, whichever is more. That's something that you'll have to add up if it's worth it to just pay the penalty versus what the cost would be to pay for the insurance. So there are some exemptions to this. The religious conscience, membership in a healthcare sharing ministry, member of an Indian tribe, hardship. These are, you can imagine, these are pretty finite categories. There's going to have to be some proof given. Tracy we were talking about earlier today, that you're going to have to prove that you're part of an Indian tribe, prove religious conscience. So these are not easy categories to fit into, but these are the ways that you would be exempt from that fine. Also, there's also an individual mandate for children. Children are also required to be insured. They can either be insured through public insurance, and we're going to talk a lot more about public insurance in a little bit. They can be insured by their parents, and that would be either through an employer or through a privately purchased health insurance plan, or they can pay a fine. And the fine for uninsured children are half of what the adults are, up to a family maximum of $285 in 2014. So, and that again, I don't have all the figures for how much that's going to go up, but it's going to be half and go up at half. So in 2016, it'll be half of what the adults are. So that tax will be assessed on your federal income tax return. So if you are going to end up paying that, you're going to need to account for that and plan for that when it comes to tax time, you're going to have to pay that in. If everyone has to have insurance, what are the options? So lots of people have employer-based health insurance, and so that's still going to be an option for people. If they have that already, they can continue with that. Privately purchased health insurance is an option, and we're going to talk more about that. And then there's public programs, so Medicare and Medicaid. In Wisconsin, we call Medicaid Badger Care Plus, and we're going to talk about how you can be eligible for a Badger Care Plus. And then the final option is the newest option, and that is buying insurance in the health insurance marketplace. And this is the federal website that has gotten a lot of press lately. So we will go over that more too. First of all, if we want to talk about where your income level is and what that means for you for health insurance, we have to talk about the federal poverty guidelines, because the federal poverty guidelines are going to drive where you fit in to an income level. So the poverty guidelines are a measure used to determine eligibility. They're used for lots of different things, and again, they're used for this health insurance program to figure out where people fit. We're going to go over what those federal poverty guidelines are. And of course you need a table because it's complicated. So if you look in the far left column, group size is going to be family number. So if you very simply look at the first column of 1, that's 1 person in the family, up to the bottom is 6, that's a 6-person family. Across the top is 100% of the federal poverty guidelines, and then it goes up from there. And everything is based on this 100% and going up. So if you were a family of 1 and you made $11,490 a year, you would be at the federal poverty guideline. And then everything goes up from there. If you make twice that much as a single person, then you're 200% of the federal poverty guideline, or $22,980. But if you were a family of 4, if you were at the federal poverty guideline, it would be $23,550. And if you made 3 times the federal poverty guideline, that would be 300%, and that would be $70,650. So that's kind of how it all goes. You have to look at your family size and then see where you would fit in onto that table to figure out where you're at. And there's lots of online resources for calculating all of that. So first, I try to briefly go over Badger Care Plus, just so people are aware of where that is. There were some changes made to Badger Care Plus when the Affordable Care Act came out, and the states were given an option whether they wanted to, create their own marketplace. There was lots of decisions made by the states about how they were going to change things. So this is how things happened in Wisconsin, and this is if you look at the green part of that, those are the people that are going to be fitting into Badger Care Plus. Any part of the pink part, they're going to be now going to the marketplace. So for example, children that are in a family that is 300% of the poverty level or under, they are eligible for Badger Care Plus. And same thing with pregnant women. Whereas parents or caretaker relatives, they can only make 100% of the poverty guidelines and under to be able to be eligible for Badger Care Plus.
But that's what's in the news right now also.
Right, yes, fill this in, Jean.
Right, so parents and caretaker relatives have been eligible up to 200% through 2013. That was going to change, and they were going to drop to 100%, and they were going to be joined by adults who were not parents of eligible kids at that 100% level. But the governor there was a hearing yesterday. There will be a vote tomorrow, apparently, and another one in about a week and a half, hopefully instructing a change that the parents and caretaker relatives presently eligible at 200% would stay eligible until April 1, and this 100% that shows on the graph will actually not take place until April 1 of 2014. So that is up in the air right now. The federal government also has to approve those changes, and so there's some people in Badger Plus in flux right now, and we don't really know what's going to happen.
Yes, and that's been a challenge, that there's been so many changes every day that it's difficult to tell anybody where things are at, because you're never quite sure. But yeah, so that's kind of a wait and see thing right now. That was Badger Care Plus, and that gives you an idea of where you could fit in to receive the state Medicaid. Next, we're going to talk about the Marketplace. And the Marketplace is the federal health care website where you can buy insurance. And it's called the Exchange, it's called the Marketplace. It's got lots of different names, but it's healthcare.gov, and that's where you can buy insurance. And the website is on here for you to go to if you wanted to go there. So starting on October 1st, supposedly people were supposed to be eligible to start applying. Of course, that's been the problem, is the website didn't work. So there's been a lot of delay. But Tracy here next to me is a person who has gone through and bought insurance on the Marketplace. So I have a living, breathing person that has been through and done it. So we know that you can get through now. She had a lot of persistence, though.
Yeah, our office was successful finally October 24th.
October 24th.
But no one in our building has been able to get on since. They tell us that I'm just a ghost story. So
well, I was excited to find someone who had done it.
I was very persistent. My daughter had to have insurance.
So there is also a 24-hour call center that's available, and that the phone number is up there too. There's a chat feature if you're using the online Marketplace that you can use to chat with someone to walk you through it. Open enrollment is guaranteed October through December 7th of most years, but there is an extension, and always has been an extension for this year, going till March 31st of 2014. So if you go on the Marketplace and purchase insurance before that, you will not have to pay the penalties. There are some qualifying events for enrolling outside of this schedule, but it's things like death or marriage or birth of a child, things like that you can't make up easily. So that's going to be a challenge. Something that I saw right away looking at this October to December 7th is, what a terrible time for farmers. It's not the best time for farmers to be going through a quirky website, trying to, on a spotty internet service, trying to get this done. It's not a good time period. So it is going to be a challenge for farmers every year to carve out the time, particularly when we have harvest pushed late like it is this year. It's going to be a challenge. So, and I don't think the corn still coming off is a qualifying event. So it's
not yet.
No. Yeah. So,
right. If beyond your control or whatever, your insurance would end, or even if you lost a job.
Yeah.
If the job ended and the insurance went with the job, that would be a qualifying event, sure.
So on the website, on the Marketplace or the Exchange, you will see that there's different levels of plans that can be purchased. They're all given a medal, and so bronze, silver, gold, and platinum. And these different medals stand for levels of coverage. So the bronze is 60%, going up to the platinum is 90%. So what that means is that the plan, if you bought a bronze plan, the insurance plan will cover 60% of your health insurance costs, and you will be responsible for the other 40%. And so going up the line. So as you can imagine, the bronze plans in general are going to be less expensive premiums, but you'll have more out-of-pocket expenses, whereas the platinums are going to be more expensive premiums, but you'll have lower out-of-pocket costs. So that's how they'll all set up. If you go on and look around, you'll see that they're all the plans are given one of these metal coverage labels, and so that's how you guide yourself through what they cover. There are still catastrophic plans, and the catastrophic plan is a high deductible, low premium cost. It covers essential benefits, but only after you've reached your deductible. So you'd have to get to your deductible first before you're going to get those covered. I do see some questions coming in. I think I'm going to wait until the very end for questions, and we're going to see what time we have left. I've asked that most of the counties have specialists or experts in the room with them, so that from 8 to 8:30 the experts will be able to answer questions, but we'll do what we can if we have some time left over. So thanks for the question, Price County. We'll hold on that for a minute. Catastrophic plans can be offered through the marketplace or outside of the marketplace, but the eligibility is going to be trickier now. You have to be under 30 before the plan begins, or you have to be exempt from the individual mandate because you can't afford the coverage option. So you'd have to show that you have a hardship and you can't afford it to be able to get the catastrophic plan. So the deductible on the catastrophic, they usually have a large deductible. It's usually equal to the out-of-pocket cost limit of the Affordable Care Act. And we haven't talked about the out-of-pocket cost limit yet. I'm going to get to that soon too. But the deductible is usually going to be equal to that, and I'll give you those values in a minute. Preventive care benefits do still apply to this plan, and you get up to 3 annual primary visits free of charge a year. They did that hoping that people would at least get some regular health maintenance, so to speak. So individuals purchasing catastrophic plans are not eligible for tax credits. So those are not, you would get no subsidy to buy those. So of course the advantages are for people that can't afford the traditional premiums, or young, healthy people that feel like that's a better option for them. It covers them if they get into a really bad situation, illness or accident, but they don't need as much day-to-day health care. The disadvantage is the plans may not cover those essential health benefits, and the cost for your routine care can really add up before you get to your deductible. So it can be expensive if you need some care throughout the year. So we're going to talk about the subsidies or the tax credits now. And you'll see on the far left column is that federal poverty guideline level. And like I said, that's going to drive all of these. Everything that we talk about is driven by where you fit in percentage-wise, where your salary fits into that scale. You're given subsidies from the federal government to buy insurance based on your income level. So if you make up to 133%, that very top column in this table, then you only have to spend 2% of your income on premium costs in a year. So the salary for 133% of the federal poverty level would be $15,000 a year, that's about $7.35 an hour. And so your approximate maximum annual premium would be about $300. So the rest of that cost for that plan is going to be subsidized by the federal government. That if you look at that far left column again and we slide down and go all the way down to the 350% or 400% of the federal poverty level, that is about $45,000 a year for an individual, or $22 an hour, and the maximum that they can pay annually would be $4,366. So keep in mind this is for an individual. It's not for a family. So people, just a minute to look at that slide before I move on because I know there's a lot on it. So I talked a little bit about the out-of-pocket cost limits. This is something else that is new with the Affordable Care Act. Starting in January of 2014, an individual cannot spend more than $6,350 annually on out-of-pocket costs for health care or $12,700 for a family. So this is limited to co-payments and deductibles. This is not premiums. So you can spend money on premiums that doesn't count you up to this total. And people with incomes below 250% of the federal poverty levels will get subsidies to lower those levels. So that's a new thing with the Affordable Care Act as well. So now I'm going to get into some specifics about farmers. And I hope I don't jump around too much on this, but there's several points that I wanted to make that I think are specific for farmers. First of all, determining your adjusted gross income. This is not, you're going to have to choose your health care plan from October to December 7th of the year before you make the money. So who knows what dairy prices will be? Who knows what corn prices will be? Who knows how your crop will do? All of that stuff. You don't know what will happen in the year before, so you're going to have to make a guess. And you can, you could probably make a pretty good guess, but for all the reasons that farming is challenging sometimes, we don't always know what's going to come with the year. So if you do overestimate your adjusted gross income, then you're going to get a reduced subsidy, so you're going to pay more for your premiums throughout the year. But that subsidy, when you get to the end and you file your taxes and then you actually know what your adjusted gross income was, you will get the subsidy that you should have gotten for that income credited back to you with your tax return.
So be careful on that because you must have purchased a policy from the exchange.
Right.
You can't have purchased it anywhere else or that will not apply.
Yes, thank you. And that's something that I didn't stress when we were going through the marketplace. In order to get any kind of subsidy, you must go through the marketplace. And I presented this to farmers last month. I think it was November 2nd or something. And there was at least 4 in the room that had already gone ahead and signed a new health insurance plan for next year, all because the plans were called marketplace plans when they purchased them, but they were not purchased through the marketplace. You do not get a subsidy. So you have to go through that channel, and that's what's been frustrating for people is you have to go through that channel, but the channel hasn't been working. But you won't get a subsidy any other way. So very good point. Thank you, Tracy. So if you underestimated your AGI and you got more of a subsidy, you will have to pay it back. So however you want to handle that, however you want to go and err on which side, I won't give you any advice on that. But
I'll give you some safe harbor advice.
Yeah.
Go by the number on your previous year's tax return. That way you can't get in any trouble.
Yeah, that's probably a safe bet. Probably a safe bet. So there you go. She's the tax expert. So. All right, so Section 105 and HRA accounts, this was something that came up quite a bit when we presented to this group of farmers last month as well. And I've spent a lot of time talking to Tracy about this because it's a little bit complicated, but Section 105 allows sole proprietors or small businesses to set up an HRA account where the employer puts money has an account, an HRA account for the employee, and the employee can get reimbursed out of that account tax-free for their health care expenses or to pay health care premiums. So for small businesses, the employee can buy their own health care plan and it gets paid for by the employer through this channel. Then the employer can also take the money that they are putting into this HRA account as a business expense. So it's kind of a win-win for both of them. Now, beginning in 2014, farms with more than one employee can no longer use this method to purchase individual plans. So, and we're going to go through this a little bit, but if it's a husband and wife operation and she's the only employee and they've been using the Section 105 way to do things, they will still be allowed to do it. But any more than the one employee, and they won't be allowed to do it any longer. So something very, very good to talk to your tax preparer about, or if you have, there's many companies that manage these Section 105 plans for small business owners and farmers. It's something that you'll want to speak with them about ahead of time so you know what your situation dictates. So let's go through a couple of farm business scenarios, and we can talk about the options that are going to be available for each of these. So husband and wife operation with minor children, husband and wife and an adult child, I meant to say one child, but adult children under 26, and then, or the multiple families and non-family employees. So we'll go through each of those. So first of all, husband and wife and the minor children. Now, just like I just talked about, possibly in the past they had a Section 105 and an HRA account and they were buying an individual plan that way, and that's still going to be possible if she's the only employee. But the other option for them is to go through the individual marketplace and purchase a family plan, and then they could qualify for a subsidy depending on their income. Now, a farmer asked me at our last meeting, so what do I do? Do I do the 105 or do I do the marketplace? I don't know. That's going to be a very personal decision based on all of the calculations that you're going to have to make to figure out which one is better financially for you. So that's going to be something that you'll have to come to as a family if you're in that situation. So let's go through an example. A farming family with 2 minor children. The parents are 40 and 42. The marketplace will ask you how old you are, and you will get different premiums based on how old you are. So you'll need to put that in. I put here MAGI. That's Modified Adjusted Gross Income. For all practice and purposes, that's adjusted gross income.
For most farmers, yeah. Basically, the only extra things that you would encounter very often would be foreign income.
Foreign income, right. So unless you have foreign income, that's the only thing that would be added back in from AGI to MAGI. Right. Okay. So I picked out Monroe, Wisconsin. I know Greene County is out there, so I thought I would pick Monroe. And then I put all of this information into the Kaiser Family Foundation website calculator to give us some results. Tracy told me right before we started tonight that she doesn't think the Kaiser's calculator is very accurate.
The subsidy calculator is very accurate. That is very accurate. I'm not sure that the plan price is later on. I don't know about that, but yes, the Kaiser Foundation.
So some of the stuff out there may not be as good as we hope it is, but I'll give you the results that I got from it just to give you ballpark. So $55,000 a year this family makes. They are at 234% of the poverty level. The maximum that they would have to pay on their premiums is 7.47% of their income. So their subsidy annually is from the federal government is going to be $55.23. Their out-of-pocket premiums would then be $41.11, which works out to be about $342 a month. So again, this, and I'm going to show you on the next slide, this is what the results look like that come through on the Kaiser Family Foundation calculator. And this shows you some of the plans that are going to be available to you and what they're going to cost. So you see these plans here are showing a higher premium level, but that's because it's not accounting for the subsidy that the person is going to get. So the subsidies are all based on a silver plan. So the cost of the premiums for a silver plan is what the subsidy is based on. If you choose to go with a bronze plan, which is less expensive, then you get more of a subsidy.
And this is actually a result from
this is healthcare.gov.
Right.
That's right.
So this premium, this is an actual premium.
Okay. That's right. I did do it that way. That's right. I mixed them together.
Yeah, you kind of have to balance them both.
Yeah. Yeah, excuse me. I apologize. That's right. Jean's right. This example that I pulled out, I did it so many different ways. I can't even remember how I did it now.
I just recognize the health team.
Yeah. So this is actually, if you go to healthcare.gov, and I'm going to give you the website, you can actually enter in your income, your ages, and you can come up with what I have up here on the screen, the plans that are available. Oh, and you have to put in your area, your zip code, and it comes up with actual plans that are available. So this Dean Classic 4500X, this is an actual plan that would be available to a farming family with 2 young kids in Monroe, Wisconsin. So this would be through the marketplace. This is through the marketplace. These are what marketplace plans look like. So, and you can see here there's other things you can click on, like details, and that's going to give you more information about the plans itself. So, and in a couple of slides I give you these websites for the Kaiser Family Foundation and for healthcare.gov. So you will have those. So let's go to the next situation. Husband, wife, and an adult child. Now, the Greene County Ag Agent actually sent me a similar one to this, so there is a question out there that came on this one. But remember, children can be covered on the family plans up to the time that they're 26. They do not have to be tax dependents of the parents, and they don't have to be living with the parents. They can even be married, but they can be covered under their parents' policy. Now, if it's a son, I don't know that his wife would be covered under the policy, but he can be covered under the policy, under his parents' policy. But the child's income must be included in the adjusted gross income, so they will need to add that in when they apply for the insurance. So here's my example. Total AGI with the child is $92,000 a year. The parents are 57 and 58, and the child is 24. So with that income level, they are at 471% of the poverty level. So up to 400%, you get a subsidy. Above 400% of the poverty level, you don't. So this family would not get any subsidy, and the premiums were $14,888 a year, or $1,240 a month. Now, I did go to healthcare.gov again, and I entered this in, and this was the plans that I got from there as well. And so you can see the premium cost on there was $11.27 per month, so that's a little bit lower. If you were to scroll down through healthcare.gov, you'd see lots of different plans available. The silver plans don't all cost the same, depending on who you're getting them from. The deductibles are going to be a little bit different, and the details are going to be a little bit different, so you'll have to look at all of those things in there. But I wanted to add in these examples and show you some screenshots from healthcare.gov so that you have an idea of what this stuff looks like when you get into it. So my last situation was the multiple families and non-family employees, and I'm going to talk about that in the next section that's coming up. That's going to move us into the business section. We're going to divide businesses up into large businesses and small businesses, and we're going to talk about what both of those, what changes have come down and what it's going to mean for both of those. So I'm going, let's see, do I have anything else here? Oh, my helpful tools. So here's healthcare.gov, find your premiums. This is exactly what I used. You put in your state, county, ages, and you get your plans in your area and the premium costs. There's also the subsidy calculator from the Kaiser Family Foundation, and like Jean said, those subsidy calculators are pretty accurate. So do use those. I think those are both helpful tools that I've used quite a bit as I've been learning about that.
Can I make a comment on the family of four sample?
Mm-hmm.
That indicated by the the income that was in there, it said they were at 234% of the federal poverty level, and there's another part of the ACA for income levels between 100 and 250% that those folks may also be eligible for additional help with out-of-pocket costs, such as co-payments and deductibles. After that 250% of FPL that goes away, that's not a tax subsidy that will actually be paid to the healthcare provider. So if you had a co-payment that the plan said your co-payment was $30 per visit, it could be reduced if you're in that income range. So there's two ways to get help from the government. One is the tax subsidy up to 400%. One is additional help with out-of-pocket, which is at the lower 250%. And it's relative, I think, to the question that's sitting out there that said, I thought you didn't get subsidies if you chose a bronze plan, but you must choose a silver plan. And the subsidies actually are calculated on the silver plan, but you can apply that amount of subsidies to a bronze plan, which has a lower premium. But the amount of the subsidy doesn't change. It's just applied equally, as Heidi said. So there are sort of two different thoughts there. To get the help with out-of-pocket costs, you must choose a silver plan. So that's 100 to 250%. And this is why you need a friend and someone you really trust to help you walk through this, because there's a different rule for a lot of these things.
Yeah. So the subsidy, again, just to reiterate what Jean said, the subsidy is based on a silver plan. If you chose a bronze plan, the subsidy would pay more of your premium, but you're going to have more out-of-pocket expenses because it's a bronze plan. Same thing, if you chose a platinum, they're gonna give you a subsidy based on a silver, so it's not gonna pay as much of your premium cost. So a couple of different ways to look at it, but the subsidies all based on silver.
So if you get a copay on your copay, does what they pay still count against your total out of pocket for the year?
I'm sorry. You know what? We're going to take questions.
Write that down.
We've got a participant here in Dane County that's asking questions, and I know you all can't hear her, so we're going to have her write that down and hold it till the end, and from 8 to 8:30 we'll take questions. Sorry about that, everyone out there. So we're going to move next into the farm owners as employers. And so again, this same slide that I had up earlier, this play or pay, employers that have more than 50 full-time equivalent employees must provide their workers affordable and adequate insurance, or they have to pay the government penalty. So I'm going to spend a little bit of time on the large employer aspect, just to make sure that I'm covering everybody who might be listening out there. I understand this might not apply to many farms. So first of all, what's adequate and affordable? Affordability is considered the self-plan for your employee. If you provide insurance for your employee, their plan must not cost more than 9.5% of their annual income. So that's what is being called affordable. Adequate means that no more than 40% of the total health care cost of an individual would be expected to be paid by that individual. So the employer must pay 60% of the health care premium. Say next, Becky.
Not that the employer must pay 60% of their premium, but the employer must provide a plan that's at least of the bronze category.
That's at least of the bronze category. You're right. Yep. Excuse me. Thank you, Tracy. So how do you figure out if you have 50 full-time equivalent employees? This is where it's fun. So this is the easiest way that I came across for recommending that people do this calculation. You need to, first of all, add up all of your employees that work more than 130 hours in a month, and then add up the hours of all of your part-timers that they work in a month and divide it by 120 and get a number for that. And then you add those two previous numbers together. You need to do that for every month of the year, and then divide by 12. So that's going to give you an average. If you come up with 50 or more, then you are considered a large employer and you will be required to provide insurance or pay the penalty. If you came up with 49.8, you will not be required to provide insurance. So it cuts right at 50. Any decimal points don't round up underneath that. There is a rule that may affect some farms. There's a seasonal employee rule. So if you have employees that are seasonal workers, which means you have lots of employees for certain times of the year, then that doesn't necessarily drive your numbers up, because if you average 50 full-time employee or full-time equivalent employees for less than 120 days, you would be exempt from that rule. So that's one thing that may bring numbers down for farm operations that are really ramping up numbers at certain times of the year. All right, so I'm not going to go over this slide in detail. I mostly put it in here so that people have it if they feel like they do fit in that category. I don't, after talking to lots of people about this, I don't think that there's a large number of farms in the state of Wisconsin that were going to fit into the category of 50 or more. So I don't think that it's something I'm going to spend a lot of time on, but there are some penalties for a large employer if they don't provide adequate and affordable insurance for their employees, and I will let you go over some of those if you'd like to. So what if you have less than 50 employees? This is where a lot of farms are going to be fitting in. So if you have less than 50 full-time equivalent employees, you're not mandated to offer health insurance, but your workers are still going to be required and mandated to have their own insurance. So they may be going to the marketplace and that kind of stuff, or even available or eligible to get Badger Care Plus. They may be eligible for Medicaid. So just because you're not mandated to provide it for them, they are mandated to get it. But if you do choose to offer a plan for your employees, you must offer it equally to all of your employees, even if you're a small business. And you still need to calculate your full-time equivalent employees, but it's done differently for small businesses. So I'm going to provide another calculation for how you're going to add up your full-time equivalent employees if you're a small business. So first of all, you want to exclude the owner, or also family members or dependents living in the household, ministers, which I'm not going to go through that one. You can read that one.
Very tricky.
Yeah. And then you will also want to exclude seasonal workers, again, who work for you 120 or fewer days during the tax year. Then add up the total hours of other employees in the tax year and divide it by 2,080. Now, one caveat there is you don't want to add, if an employee works more than full-time, you don't want to give them more than full-time hours. So they can only work full-time. Only full-time hours should go into that calculation, not the exact hours that they worked above 40. So if the result that you get is not a whole number, then you round down to the nearest low number. Now, why do you need to calculate the full-time equivalent number? That's because there is a tax credit available for small businesses. So if the small business has less than 25 employees and their average salary is less than $50,000 a year, that business would be eligible for a tax credit. The maximum tax credit that the employer can get is 35% of the premiums that they paid for their employees. That was in 2013. In 2014, they can get up to 50% tax credit for the premiums that they paid. But again, that's the maximum tax credit. The maximum credit you get is if you're in the ideal situation, and that is 10 employees that make an average of $25,000 a year. If you have more employees than that, as you go from 10 up to 25, and as your employees make more money, the tax credit starts to fade out. And it fades out both at the same time. So you could have, I don't know, I don't want to get into examples here, but because I'm probably going to get it wrong if I give anything exactly. But you could have less than 25 employees, but they're making more money, so the tax credit has already faded out by then. So it's a double fade out for the tax credit. So, all right. So the shop, there's another second website for small businesses to purchase insurance for their employees. And this is called the SHOP, Small Business Health Option Program. It's again at healthcare.gov, and you'll see an option for small businesses. But I just had to add this part into my presentation just within the last couple of days. This website is now delayed. So they've decided to focus all their fixing energy on the individual marketplace, and they're not going to fix this website until next year. So small businesses would need to go through a personal tax broker, fill out the forms, and turn in their application, and that's how you would have to do it as a small business. Sure. But the only way you can get a tax credit is to go through this system of applying through this. You, again, just like the individual healthcare marketplace, if you want a subsidy, you got to go through that marketplace. If you want a business tax credit, you've got to go through this. So that is still required and still a part of it. All right, so I was going through some examples before, and I had the farm business that has family and non-family employees. So there's a couple of options. They can apply for a group plan through SHOP, and then they can get a tax credit if they meet the criteria. And but now, of course, they can't go through the SHOP website to do that, but they can still go through the program. Or they can encourage employees to apply for their own insurance through the marketplace. And I'm going to talk a little bit about managing employees in a little bit, but that's an option for them as well. Now, Tracy has been sharing with me all kinds of other options out there that may work, but there's going to be some changes. I talked a little bit about Section 105 and the HRA accounts early on when I was talking about individuals purchasing insurance. But HRAs, FSAs, and HSAs have been ways that small farm businesses have been able to provide some health care support for employees without purchasing a group health insurance policy. These options are still on the table, but they've changed a little bit. So in the health reimbursement account, which we talked about earlier, it's funded by the employer puts money into it, and then it used to be that the employee could then purchase their own insurance. Well, now if you have more than two employees, more than one employee, you can no longer do that. So the only thing HRAs can now be used for is vision and dental, and no longer premiums. So that's going to be a big change that may be a big change for a lot of farms. There still is the flexible spending account, and this is an account that would be funded by the employee. There's now a limit of $2,500, but the employer can also add in an additional $500. This can be used for medical expenses, but it cannot, again, be used for premiums. The last thing is the health savings account. This can be used in conjunction with a high deductible plan, but there is a limit annually of $3,300 for individuals and $6,550 for families. And Tracy, is there anything you'd like to add with that?
You can add $1,000 to the bottom numbers if the people are over 55.
Okay. Yep. Add $1,000 to those numbers at the bottom.
And pretty much everyone now has a high deductible health plan.
Yeah.
I mean, it's almost, the minimum amounts are
they're considering a high deductible plan. I think it was for an individual $1,250 a year for a deductible. So that's really not a high deductible in the world that we're talking about right now.
The HSA can be used for premiums?
No, the HSAs cannot be used for premiums. No. The FSAs and HSAs never could be. The HRA was the only one that could be used for premiums. So I think the reason for this, if I can ad-lib a little bit here, but you know, really these are pre-tax accounts. So the reason I think that the government blocked this was because if you get money pre-tax to pay for the premiums, and then you apply for insurance in the marketplace and get a subsidy, it's sort of a double dipping, and so I think that's why they went that direction. So I shouldn't ad-lib though. Moving on. All right, so here's my example of a farming operation. We're back in Monroe, Wisconsin again. There's 6 people in a group plan for the farm. Their ages are 36, 42, 24, 42, and 60, and 63. Their average salary is $35,000 a year. And when I plugged this into the small business calculator, which I've included a link to too, the results were that the premium cost was going to be about $2,600 a month for the 6 of them. And this is the one, might be a little bit off because I believe I got that premium from the Kaiser Family Foundation one. So that one might be a little bit off, but that was what it came up with, was about $2,600 a month. And it was giving the full tax credit for that. So with 6 people, average salary of $35,000, you got full 50% tax credit the business got back on for paying that. So, anything else there, Tracy?
As usual in practice, it doesn't end up quite that easy, but that's the general idea.
Tracy works for a small tax preparing firm, and so they actually have gone through the process of applying for looking at the premiums for a group plan. And for the group plan for yourself and your daughter, it was how much?
More than double.
More than double what she got when she went through the individual marketplace. So that's something a small business is going to need to look at, is what is the premium cost if they buy that group plan? What's the premium cost, and how does that compare to what the individuals would be getting if they just went out and bought it in an individual marketplace? Oh, I did. I put it I keep forgetting what I put in my talk. Here's some actual plans that I got from healthcare.gov when I did when I pulled it up. I put in everybody's ages, and then I got this. This would be for a group plan with 6 people with those ages that I showed you. In Greene County, Wisconsin, this is what would be available. So these are a little bit, these should be pretty accurate then, because it is from healthcare.gov. So that gives you a little bit of an idea of what it will look like, and then you get the tax credit at the end of the year to help with this too. So, all right, so this was the small business tax credit calculator that I used. So this is not the credit that I calculated. I did not get that off of healthcare.gov. So you have to take it's like everything on the internet.
Yeah, to actually get the credit, you will have to, if you're confident enough to do your own taxes, that's one thing. If you're not, you will actually want your tax preparer to do the form and file that credit for you, because it is an actual tax form.
Right. And that's something that Phil Harris talked about when we had him here talking with us last time, is that this is going to be another load of responsibility for the tax preparer that you have, and they may be learning with you as to how all of this goes and what are the right things to do and what they can get you. So you may need to know some to help them along the way. Am I saying that right?
Yeah, there will be a lot of questions between the 2 parts.
Okay. So last thing I wanted to talk about quick is you, as a farm owner, you're managing employees, and so they, like I said earlier, they're still going to have to purchase their own insurance, and so you may have to be handling people that are going to be facing some big decisions too. So many farms will probably, I put likely opt to allow workers to purchase their own insurance. I guess I'm making an assumption there, but that may be the option that a lot of farms come to. So, you know, they can talk to their employees about the options for the health insurance, for their insurance. And some of the language that Jean and I kind of talked about is that telling their employees that the business can take a tax credit or the individual can get a tax subsidy. So one of the ways that you could share with your employees how to go through this process is say, I'm going to let you go ahead and try to get your own tax credit rather than me doing it with the business. So it's one way to go about having that conversation. Once the workers or your workers go through the marketplace, they can be informed of their eligibility for their subsidy, so they may get subsidized insurance. They may be eligible for Medicaid, or their children might be eligible for Medicaid. So, you know, if there's farm workers that haven't been insured before or their children haven't been insured before, you know, maybe having that conversation, if you're more informed, to let them know that there's options out there, it might make all around for a better work atmosphere for everybody if there's more health care availability for them. So that was my only thing that I had to talk about with the farm business workers. So if you do have a farm business and you are not sure how close you are to the 50 FTE, you should consult with a professional. I gave you some back of the envelope calculations, but you want to make sure you know that one. That's going to be very important. So small businesses should calculate their eligibility for a tax credit and weigh their options for what they want to do from there on. Does it work out financially as a good decision for them to do that? Or is it better for them to have a conversation with their employees and encourage them to go to the marketplace? So that, I hit those both points. Okay, so some dates to remember. So there's still an individual mandate that's still on the table as of yet. That hasn't been changed. So in 2014, everybody must have insurance. There's a 6-month enrollment period just this year for the exchanges. That's October 1st through March 31st. In subsequent years, it's going to be October to December 7th. So the small business website was delayed until next year, but small businesses can still sign up for marketplace plans through a broker and get the tax credit. And the large employer mandate, I didn't mention this when I was talking earlier, but that large employer mandate was delayed until 2015. So if you are on the line for knowing if you have 50 or more or not, you have a little bit of time before you're mandated to have insurance for your employees. And that's it. So I see it's 7:37, so we can answer a few questions. I think I missed one from Pierce. So I would like everyone to type into the chat box if they have any questions, and when the questions slow down, then we'll just sign off and let you go to your individual sites. Or if some of you want to sign off now, I won't be hurt. So I'll just go through the first question from Pierce County, and feel free to type in the chat box if you have one. So, is your income based on gross or net? Can farmers depreciate enough to be considered at poverty level? So,
want me to answer that?
Yes, I want you.
Okay. Your income technically is based on your net in the respect that it's your adjusted gross income from your tax return. Can you artificially depreciate enough to be considered at poverty level? Yes. However, that can change drastically from year to year. You want to make sure you don't take advantage of that so much that you get such a subsidy that next year you're paying all of what you would have, all you got from the government back to the government. But yes, you can do that. People are trying to do it. They're going to continue to do it. There's lots of ways around these things, and there's an area that is going to become difficult to enforce in a lot of this, and I won't get into all that unless somebody specifically asks a question, because I'm sort of the IRS police as well, I suppose. So,
yeah. Okay. Yeah. Well, thank you. All right. So the only other question is I see from, oh, wait, there's more coming in. I think we got the second one from Pierce County about the subsidy. Yep. Okay. So we've got Can employer with less than 50 people tell employees to go to the marketplace and get whatever subsidy they can, and then the employer pays some of the employee's monthly costs?
No.
Tracy's shaking her head no.
Any of that money paid to the employee will be considered wages. It will have to go on their W-2. The way you get around these kind of things is you offer things such as an HSA, an FSA, things like that where you and your employee together are sitting down talking, putting money aside to pay for co-pays, prescription costs, hospital visits, so that when the money is really needed to go to the doctor, that's there and that's ready. So you can't help them with their premium, but you can help them with other parts of it. So no, the IRS is well, and Health and Human Services together, they've both said as of January 1st, no, that's if you want to help employees pay for their insurance, you can raise their wages. That's really about the only thing.
Okay. All right. Well, I don't see any other questions rolling in here, so unless somebody types before I finish the sentence. All right. I think we will sign off here. Well, we'll take questions. We're going to take questions here after we sign off. But we're going to sign off here. If you have any more, somebody typed. Look at that. All right. So is there a stipulation that farmers have to file jointly?
Not that I'm aware of, but there's always loopholes. I mean, there may be something crazy out there I don't know about, but we haven't done it that way.
Okay. So she says she doesn't think so.
I don't think so.
Okay. So if another question came in, if a small employer offers group insurance that is affordable according to the ACA guidelines, can his employees who choose not to join get a tax credit on the marketplace for his spouse or dependents?
Can you replay the beginning again? I want to see this.
So if a small employer offers a group insurance that's affordable, can the employee choose to not take it and go get the tax credit?
You can choose not to take your employer's plan, but if it's offered to you and the government says it's affordable to you, you cannot get a subsidy on the healthcare exchange.
But is that even for small businesses? See, that's where it's tricky. If it's a small business, that's not mandated.
But it's still an employer, and it's still an employer-provided plan.
Yeah. People that asking those, can the employee be on it? But the spouse and children in the marketplace.
Yes, and when that happens, then you get into some crazy calculations, and everyone has admitted that a lot of that has not been perfectly addressed yet. Yeah. So
there is a lot in this that hasn't been addressed or we don't know. I mean, I think one part of this is happening right now where everyone needs to make decisions on insurance and all of that. Another thing is going to happen, or another shoe is going to fall when people file taxes and we figure out how everything is going to work out that way. So
here's an example. So assume you have a marital separation agreement or you're divorced, and the non-custodial parent is claiming children on their tax returns. Okay, that non-custodial parent who claims those children on the tax return, the custodial parent saying, okay, I give you that right. Those children are on that non-custodial tax return. That parent is going to go to that parent who claims them as dependents to prove they have them covered with insurance. So this is going to end up being, I think, the number of IRS notices people are going to get after all this is going to be just enormous. But it doesn't mean that the notices are really wrong or you're in trouble. It's just extra things you have to address because they don't know yet all the repercussions of this. It's just going to be a lot.
Okay. Langley to say I missed them. No, Langley, you said, wait, did I miss something? No, you said is there a stipulation that farmers have to file jointly? And Tracy answers not that she's aware of.
But I could be wrong.
So will this webinar be available online after this evening? Good question, St. Croix. I think I will put it on the Dane County UW Extension website. I will post a link to it. So if you go to the Dane County Extension website, go to under agriculture, there'll be a pull-down menu, and I'll put Affordable Care Act on there, and I will put my presentation in don't try it by 8 o'clock tomorrow morning. It won't be in there yet, but I will do it in the next day or two. So does AGI include 4797 and depreciation?
It would, just because as a farmer, your business income and expenses is going on Schedule F, which is then dumping everything over to the front form of your 1040. So yes.
Yes, yeah. How will it work when a farmer sells his cows in 2013 and has a really high income, but in 2014 has a much lower income? Well, you're going to have to figure out, you're going to be guessing for 2014 what your income is going to be. You know you won't have the sale of the cattle, so you can just decrease your income by that much. So, our specialist here thinks that there's no stipulation to file jointly, but to get the tax credit, you do have to file jointly.
That may be true, because if you can imagine, think about the IRS trying to figure out who gets what portion of what credit when you're not on the same tax.
Yeah.
So, that could be a nightmare.
So if an individual chooses the bronze plan, are they responsible for 40% of health care costs up to individual maximum, or an amount more than that? Example, a catastrophic event of $100,000 plus.
Those percentages are based on an actuarial calculation of all the historical information insurance companies have. So it's not like you go and you have a $100,000 bill, so you pay 40 and they pay 60. It's not really like that. It's a predetermined, here's your deductible. Once you hit your deductible, here's your maximum out of pocket, and we'll pay the rest. It's just historical actuarial values calculated by someone, with a great computer and a brain and a room, and it doesn't mean that much to the average person. If insurance companies get to the end of the year and they haven't paid out their required percentage of expenses, like I think it's 85% of all their costs have to be paid out in health care expenses versus overhead, paying salaries and doing all these other crazy things, then that's actually supposed to come back to all the policyholders as a rebate. So there's some responsibility there for the insurance company to make sure that they're not spending money on unnecessary things.
Good. Yeah. Okay. I'm glad that came up, because I've been. There's so many details to this that
Yeah, it's between the 2,000 to 3,000 page legislation.
Yeah. All right. So I think we've come to the end of the questions that are rolling in. I'll talk slow again if anybody's typing.
Patty? No. Unfortunately.
Will there be a tax credit if you don't go through the exchange, health, i.e. HSAs?
No. I mean, an HSA would just be used to set aside money to pay for your out-of-pocket expenses, and that can be, of course, a pre-tax benefit for you, but there's no tax credit for anything to do with your premiums or anything of that nature.
Yeah. So no, got to go through the marketplace for an insurance plan that would give a tax credit.
But let's not forget that if somebody does buy an individual policy and you do run a business, there's always the self-employed health insurance credit on your tax return. That's completely different from a subsidy that we're talking about here.
Yeah.
That's not going away. It's not like you're going to be buying insurance and never getting any benefit from it.
And you are likely to hear in the news that the state of Wisconsin has asked the federal government, could we change the rules and give tax credits to people that get insurance off the exchange? And the federal government has not answered that question, and I think Wisconsin has asked it more than once, and the federal government continues not to answer it. But I think you'll see that in the news very soon, that it's been asked, which just makes it more confusing. And I have no idea what the answer is going to be. I can't imagine they will, but you never know.
Yeah, to come. Yeah. All right, one more question from Winnebago. Although 6350 and 12.7 are the ACA maximum out-of-pocket costs, doesn't out-of-network expenses ramp up those costs? Yes, we've got a lot of head shaking going on.
Yes, that's possible. And that when you read on healthcare.gov, when it shows you the plans from which you can choose, it will show you the differences between using an in-network provider versus out-of-network provider. So you can, especially if you know you have a specialist that you see that's out-of-network, how much more that would cost you. And that's why some people might then choose a plan where the premium might be more expensive, but because they know they need to use an out-of-network provider, overall the cost might not be greater because they paid for it up front in the premium. So it takes a fair amount of analysis on your part when you look at these plans next to each other, thinking about your particular situation.
Well, I will not only post, now I'm thinking while we're talking here, on the Dane County UW Extension site, I will put links to some of the things that I sent out to other agents tonight and that I handed out here in Dane County, and that is a marketplace application, so people can take a look at that. I'll put a link to that there. I'll also put a link to the Smart Choices Workbook. The Smart Choices Workbook is a packet that you can go through to try to calculate what your family's health care costs are and look at your budget and use it to try to guide you in making decisions about what health care plan you want to choose for your family. So I'll put that up there as well. So, and I think there's no other questions coming in now, so I'm going to stop. I'm going to just remind my fellow ag agents again to please hand out the evaluation that I sent to you, and please collect it from people, and so that I can get some feedback for how they thought tonight went.
Hey Heidi, this is Adam in Richland County. Can you hear me?
Yes, Adam.
There's a question here. Does a subsidy count as taxable income?
No. Is that short enough for you?
Not now.
Not now. Yeah.
Okay. Ask the end of January. Yeah. No, not now.
All right. Okay. Well, thank you all for coming tonight. I appreciate it, and good luck.
Thanks, Heidi.
You're welcome.